Amanda McCreary is a social service coordinator at the West Virginia Department of Health and Human Resources in Wheeling. She's among the state employees on the front lines of the foster care crisis in the Northern Panhandle.
There's a whole bunch of older children who just want a loving family. A lot of teens, preteens, they just want a forever family. And it's heartbreaking to listen to them call their social worker and their social worker answer the phone and say, no, I haven't found you that family yet, but I'm still looking. They want to know. They want somebody to want them.
According to the DHHR, West Virginia is the #1 state in the country for children removed from their homes. 85% of those Child Protective Services cases involved drugs. As of September 2018, almost 7,000 West Virginia children are in foster care, and that's just the tip of the iceberg. The DHHR estimates that in order to really take care of our kids right now, we need more psychiatrists, school nurses, social workers, healthcare facilities, and all that's estimated to cost the state more than $150 million.
There's just not enough people out there. We're overwhelmed. The whole opioid epidemic, the need for foster placements has just spiraled. You need more workers, you need more staff, there are more cases, there are more families being affected by this. We need more resources. So initially it's a huge, complex issue that's going to require a lot of money that West Virginia as a state probably doesn't have.
Foster parents today are desperately needed, but with such a strained state system, parents have to be prepared for what they're getting into. David Johnston is a United Methodist pastor. He and his wife are foster parents in southern West Virginia. He says kids are coming into the system with a lot of trauma.
And that's a lot to deal with as foster parents, and to try to help kids walk through that at the same time navigating a really overburdened system is difficult, because in addition to just the daily struggles of being a parent, which are hard to begin with, then you add behaviors born of trauma on top of that, and then having to get them to eye doctor, dentist, doctor, therapists, possibly visits with their biological parents, getting to court, multidisciplinary team meetings. I mean, the amount of time it takes, in addition to just the time it takes to be a parent, can be difficult.
Johnston says foster parents need support from their communities and workplace flexibility in order to properly be present for their kids.
Getting out of our silos, I think, is as important to doing this work. That it's going to take a coordinated effort between child services, between law enforcement, the courts, churches and other religious communities, and everyday people. I think trying to reach out to employers as part of this to help them understand a role they can play, both in giving people in recovery jobs as well as being compassionate towards workers who are dealing with kids in foster care or kids who are navigating behavioral difficulties born of trauma.
Experts across disciplines, healthcare, schools, court, all agree that the landscape of their workplaces has changed drastically in the last 20 years. People throughout the region who work with children all report increases of traumatizing childhood experiences, which could have devastating impacts on the health and well-being of these kids, as well as the future of the state.
We've got to find a way to put them on a different path in life. And if we do not do that, they're going to repeat history. It's going to be generational.
Jessica Watt is a school counselor at Madison Elementary in Ohio County. She was at a roundtable series focused on the state's child welfare crisis this fall. Watt spoke about the new normal she's experiencing at her elementary school, where children are routinely recounting violent acts at home as if they are ordinary occurrences. Madison Elementary has since embraced trauma-informed practices, where teachers and staff have all learned to recognize and respond to traumatized children. And all school employees work together to try to provide a consistent, safe, and compassionate environment.
This, to me, is more, it's life or death for these children. And so if we don't start addressing these kinds of things, we're not going to have any little people left to teach to read and write anymore. So to me, it's more important than that. And I'm fortunate to be in a building where I have a principal who gets that.
Healthcare practitioners and mental health experts from across the state are calling not just for schools, but workplaces, hospitals, recreational spaces, all institutions in the state to become trauma-informed. And this is an idea that's actually starting to take off in some places in the state. For the legislature today, I'm Glenna Sport.